Hi, this is Dr. Nisha Vishnu, and I'm a radiation oncologist practicing in Bangalore. This video is in continuation to our last video, where I was discussing the workflow of radiotherapy. If you have not seen, please go back to part 1 and understand, and please come back. So, now that you understand what is simulation, let us understand the next step, that is planning, mostly done by your treating team in your absence on your planning scan. This includes two aspects. First is contouring, that is, your radiation oncologist will mark the areas which needs to get desired dose and also mark the nearby normal areas which need to be saved. We usually use every available information regarding your disease along with the available knowledge of the disease behaviors and the tendencies to decide what areas needs to be treated. For example, if I am treating a breast cancer patient, I'll mark the treatment area of breast and all the high risk areas to which it could spread to. I'll also mark the nearby normal organs like heart, lung, foot pipe, opposite breast, etc., where I need minimum dose. If I am treating a tongue cancer, I'll mark the tongue along with the at risk neck areas where it could spread to as the target volume. The salivary glands like parotids and the nearby mandible bones and the voice box and the inner cheek areas will be marked as the normal organs which need to be spared. So, contouring is a way to tell the planning system which coordinate point needs what dose and what are the points where special precaution is warranted. After this, our team of physicists would plan the arrangement of the beams and run multiple algorithms in order to attain maximum target dose and minimum normal organ dose. Your radiation oncologist then will sit with the physics team and run through the plans, checking each and every aspect of dose. A good plan is the plan that most effectively translates into maximal effect with minimal side effects. We have qualitative and quantitative ways of checking how much dose is being received by what organs. Once we approve the plan, it goes into the machine for execution. Step 5 is treatment execution. On day 1 of your treatment, you will come to the department. We will record your weight, vitals like pulse, BP, etc., and explain to you about the treatment procedures. Positioning will be done by a team of technologists in the same way as it was done on the day of planning, with the exact same accompaniments that we used to position and immobilize you on the planning day. But this time not on the CT scan machine but on the treatment machine. We will be using laser beams to make sure that exact positioning is there. Once the positioning happens, we will start your treatment. Treatment is nothing but delivery of the X-rays as per the plan generated for you. There will be no pain and hence no requirement of anesthesia in most cases. The machine, although rotates around you, will not touch you at any point of time. And we will be monitoring you from the outside through the cameras in your treatment room. Hence, all you need to do is to relax and not move. This will be repeated every day, usually from Monday to Friday. Saturdays and Sundays are rest days mostly. I usually meet my patients once in a week or more if required. In these review meetings, we discuss the difficulties faced by the patients and we try to come up with solutions, medical and otherwise. Also, we try to foresee impending problems and take necessary actions to avoid them. For example, feeding tube placement in someone who is facing severe swallowing issues due to radiation side effects. All in all, our constant effort would be to make your journey as easy and as smooth as possible. What I just discussed is mostly an approximation of the conventional radiotherapy treatment workflow. There can be wide institutional or departmental variations as well as variations pertaining to special treatments like stereotactic radiosurgery or brachytherapy or intraluminal radiotherapy. These things will be discussed in eventual videos. That's all about the workflow of radiotherapy. Thank you.